Did you know the virus that causes cold sores kills roughly 60% of newborns it infects when untreated? In adults, it's a nuisance. In a baby, measured in weeks of life, it can reach the brain within days. Here's why the same virus behaves so differently. HSV1, herpes simplex type 1, is carried silently by between 60 and 85% of adults worldwide. Most people acquired it in childhood and never develop symptoms. For an adult immune system, the virus is managed, contained, suppressed, kept from spreading beyond the nerve roots where it lives dormant. An occasional cold sore is the visible result. A newborn has no immune memory of any virus, and critically, their cells lack sufficient levels of a key antiviral protein, type 1 interferon, that in adults rapidly blocks HSV1 from replicating out of control. In a newborn, the virus can move from a skin lesion to internal organs, liver, lungs, and then into the brain, causing herpetic encephalitis within days of exposure. Globally, neonatal herpes affects roughly 14,000 babies per year, about 10 in every 100,000 births. Of those, around 55% develop the most dangerous forms, disseminated disease or central nervous system infection. Before antiviral treatment existed, 85% of babies with disseminated herpes died within a year. With early acyclovir treatment, that mortality dropped to 29%. Brain encephalitis still leaves 60% of survivors with lasting neurological effects. Now, here's what makes this especially interesting. Most cases, about 85%, are transmitted during birth, not afterward. But approximately 10% of neonatal herpes infections happen postnatally, through contact with someone shedding the virus. A kiss on the face, a hand touched to a mouth and then to the baby. These are preventable exposures. The recommendation from medical organizations is clear. Anyone with an active cold sore should avoid kissing a newborn's face, hands, or mouth, and wash hands thoroughly before contact. The virus is common. The window of vulnerability, the first weeks of life, is narrow. But in that window, a cold sore on an adult is a different risk category entirely.